Today we are reporting 1,095 new confirmed cases and 1,075 new probable cases. 175 new probable cases. All of those new cases, we have 62 individuals who are newly hospitalized, 9 new deaths, one among a Brookings County, Campbell County, Cottington County, Lake, Minnehaha, Oglala, Lakota, and 2 Walworth County residents. I should note that there are 2 in Cottington County as well. My apologies for missing that. We have 513 newly recovered individuals who are no longer able to transmit COVID-19. And we have had a total of 6,243 tests reported to us over the past 24 hours. This does bring our COVID-19 case totals to 40,589 total confirmed cases and 1,411 total probable cases. Of all of those cases, 11,933 are considered active infections, and 29,689 are considered recovered.
Sorry, 683.
683, excuse me. The number of currently hospitalized is 412, and we have a total of 384 deaths. This does bring the total number of tests reported in the state of South Dakota to 415,689, and that is among 251,296 unique persons. Just 2 quick cluster updates to provide. So we have seen several cases being reported out of the South Dakota State Penitentiary, as well as Mike Durfee State Prison. For the South Dakota State Pen, we have 40 individuals who have recovered out of 710 cases among staff and inmates. At the Mike Durfee State Prison, we have 150 recovered out of 710 cases among staff and inmates. The other thing that I would like to provide as updates, so a question around reinfections, and so the CDC has not issued formal guidance on determining confirmed reinfections of COVID-19. There are 28 individuals in the state of South Dakota with what we consider possible reinfections. Now, these cases will be classified when CDC issues further guidance on what they will determine as a confirmed reinfection. When we're looking at some of the literature that's out there, those confirmed reinfections have typically focused on genetic sequencing to determine between the initial and the subsequent infection. And so the South Dakota Department of Health and our Public Health Laboratory does have a partnership with the University of Minnesota in order to do genetic sequencing when it's needed to identify differences in virus strains of COVID-19. When they might be the strains or the genetic distance between the viruses is needed to be looked at between 2 different specimens. The second update I wanted to provide is that we have a new feature on our website. It is the Isolation and Quarantine Calculator. So you can access this by going to covid.sd.gov. From there, you can select the Isolation and Quarantine Calculator. There are 3 different tools within there, depending on whether you're a person with COVID-19 infection and have symptoms, a person with COVID-19 infection with no symptoms, or an individual who is identified as a close contact. You'll be asked to put in either the date of your symptom onset, the date that you were tested, if you are a COVID-19 case, and then for those individuals who are considered close contacts, it would be the date from your last exposure to a person who's positive for COVID-19. And that will be able to identify, when your date of isolation ends and when you are released from isolation, as well as the last date of your quarantine and when you are released from quarantine. So this will help alleviate any concerns about individuals trying to calculate this on their own and be able to use this tool specifically. So next I'll turn it over to Secretary Malcolm Risden to give a few additional updates.
Okay, thank you, Dr. Clayton. Glad to be with you folks this morning. I wanted to update the group a bit on vaccine distribution. And so hopefully you are all aware that there are several vaccine candidates that are being tested at this point, and we expect to see vaccine being allocated by the federal government to the state of South Dakota in the very near future. We've been told to be ready for our first shipment in the middle of November. The vaccine obviously will be life-saving to thousands of South Dakotans, so we're very excited for this development. The vaccine itself will be available in 3 different phases. The first phase will focus on healthcare workers and first responders. Then, as more vaccine becomes available, we will be able to vaccinate at-risk populations, including individuals with underlying health conditions. And then, when the vaccine is more readily available, we would expect the population at large to be able to become vaccinated. We are working very actively with healthcare systems and providers across the state to ensure that we will be ready to deliver vaccine as soon as it is available, and I'm very confident in our plan to do that, in our partnerships to do just that. Individuals will have access to the vaccine at no cost. However, providers may charge an administrative fee, and that's still being worked out at the federal level. We are also coordinating with tribal entities across the state. Tribes have a couple of different options by which to get the allocation of vaccine for their members, and so tribes are making those determinations right now, and we stand ready to support their efforts to vaccinate as well. We will be using a variety of methods to vaccinate individuals with the COVID vaccine. We'll have strike teams, points of dispensing opportunities, which can be for specific populations or for the community at large. Once vaccine does become more readily available in that third phase, then people would access it much like they do other vaccines today. And so just to kind of give you a sense of some of the numbers, in our very first phase of just healthcare workers alone, we are looking at over 23,000 individuals falling into that category. And so we will be allocating vaccine according to those priorities. We are also awaiting more guidance from the ACIP committee to help states with that prioritization, recognizing the fact that we will not have all of the vaccine needed to get to everybody right away. So more to come on that. A couple of notes, even while we have vaccine available, we will still need to be using other mitigation strategies and layering those strategies on top of each other to effectively respond to COVID. So it's until we really have widespread uptake of the COVID vaccine, we'll still need to be doing those mitigation strategies. And then lastly, something that people can be doing right now to help their situation is to get an influenza vaccination. So influenza vaccination is available across the state. We have plenty of doses available. Please help us get the message out that it's very important that people vaccinate against influenza so that we're minimizing some of the complexity with respiratory illnesses this winter.
All right, with that, I'm going to unmute our lines and we'll take your questions. We're ready to take your questions.
Ben Chase with the Plainsman.
Go ahead, Ben.
Yes, just curious, with the flu vaccine this year and anyone who may be currently active with COVID or may have recently had COVID, is there any time frame that you would suggest that they wait before they get a flu vaccine?
So, I would say that individuals who are infected with COVID-19, that they do wait until they have, completed their isolation period, and that's just to allow for individuals to have fully cleared, that virus before they're given the additional vaccine for influenza, and to make sure that that is fully allowed to produce the level of immunity that we're looking for to help protect them against influenza. But that really is going to be, also a decision that you would want to make with your medical provider. There are a lot of individuals who have certain medical conditions that they need to make sure that they're identifying the appropriate timing in which to take the vaccine. But again, the influenza vaccine is a very important component of prevention going into this fall to prevent additional illnesses in individuals, so protecting yourself, your family, your friends and coworkers, but also to help safeguard some of those needed medical supplies and bed capacity for individuals who may become ill with COVID-19.
Next question.
Angela Kennedy.
I heard Angela Kennedy. We'll go with you.
Yes, my question is for Kim Melton-Risden about the COVID-19 vaccine. We know that clinical trials are underway, but you're talking middle of November to begin vaccinating healthcare workers. What makes you so optimistic that vaccine will be in the state at that time?
Sure. So that's the latest information that we're getting from the federal government around that timeline. As you know, there are several vaccines in that third phase of clinical trials, which is widespread, thousands and thousands of people taking those vaccines. That data around efficacy and safety is continuously being monitored, and so I think that there is optimism that we will see a vaccine ready for emergency use authorization by the middle of next month.
Jody Schwann, About Business. Could I follow up on that?
Go ahead.
Okay, Secretary, just I'm looking at this. Do you know which vaccine provider would be the furthest along? Because Pfizer, as of today, was saying that they're not even going to file for the emergency use until late November, and Moderna after that is December, and AstraZeneca is hopefully by the end of the year. So is there someone else who's further along? Because that's the most recent information from Pfizer, is that the EUA would be late November.
Yeah, so, and again, this is being ready for vaccine as of November 15th, so as soon as it is, in fact, available, we will be ready to vaccinate, and that's what our federal partners are asking states to do. And I'm very confident that we will be ready as soon as that vaccine is available. If it comes as early as November 15th, we'll be ready to get rolling that out. We do expect to get weekly allocations of vaccine, and so, again, with manufacturing, that will, that we may see some differences in week-to-week allocations. But again, with the partnerships that we have here in South Dakota to get this vaccine out, I'm confident that we'll be able to be effective even as those volumes fluctuate.
Next question.
This is Todd F. from Hello.com News.
Want to follow up on that?
I heard Todd F. We'll go with you.
Yes, thank you. Yesterday was kind of mask day in South Dakota, and I was wondering if the department or anyone in state government has done any sort of study on what percentage of the South Dakota population is wearing or not wearing masks during the pandemic. And so if you had anything, and if that has decreased or increased over the course of the pandemic.
Well, Todd, we have not done any studies along the lines of what you are suggesting. I think really anecdotally, I think most people would agree that we're seeing more individuals wear masks. The three of us sitting in this room are wearing masks. I mean, it's our understanding of this disease continues to evolve, and recognition of, the various things that we need to continue to do to help stem the growth of COVID in our state. So hand washing, physically distancing from other people, avoiding large gatherings, wearing masks when you're going to be around people, those still remain very relevant today.
So what's the department's role in the Mask Up SODAC hashtag and the news conference that was held by the hospitals and a number of providers and even some mayors and so forth yesterday?
So that is an effort that is being sponsored by the groups that you would have seen listed as part of their press materials. Again, that's a message that has been consistent with what we've been putting to people across the state. So we appreciate, everybody doing their part to help educate others and, practice those mitigation strategies.
And then one final follow-up, Kim. Is the department part of that promotion of the Mask Up SODAC and what happened yesterday with the big news conference?
No, the department is not a part of that effort. We've got our covidsd.gov website where we're putting out the materials that we're sharing with folks.
All right, thank you.
You're welcome.
Ray from Keloland.
Go ahead, Ray.
I want to go back to the vaccines because I want for further clarification. Early on, you made it sound as though the vaccines could be ready for delivery, but delivered by mid-November. I mean, you were very excited. And I just want to make sure you clarify that because, as asked earlier, we've got no indication that Pfizer, as on anyone, is going to be ready by mid-November.
Well, again, Ray, the federal government has asked states to be ready as of November 15th. We will be ready. If the vaccine shows up at our doorstep on that day, it will be, it will be getting out to folks immediately. And so that is the direction, and we are well prepared for that. If it comes at the end of November, we'll still be prepared. And again, we will see more than one vaccine becoming available for use in South Dakota. And again, I think we have a good plan to be flexible and nimble as that vaccine becomes available.
Next
Can I follow up on
go ahead, Ray. Go ahead.
Can I follow up on National Guard beds, and what would trigger them being assembled, and what would staff those?
So the National Guard beds, you'll recall that there is capacity to stand up to 100 beds, both in Rapid City and in Sioux Falls. They're intended to be alternative care for individuals to allow other facilities to take care of folks with the most intense COVID needs. We, as of right now, we see 31% of beds across the state that are available, and so individuals with COVID are taking up about 15% of the beds in our state. We talk regularly with our hospital partners, and they are, making the necessary arrangements to continue to be able to care for people within their walls, and so we do not anticipate the need to use those kind of alternative care sites from the National Guard at this time.
Can you explain how long it would take to get those ready, or if there's a trigger point?
Right, the National Guard can stand those up in very, very short order within, 1 to 2 days. And so that is, one of the strengths of the National Guard is their responsiveness and their ability to act very quickly.
Next question.
JP from
Jonathan with the Argus Leader.
Angela Kennedy.
We'll go to JP.
Hey, wait.
And then
Hello. You've had a lot of questions here, okay? So stand down.
Okay, thank you very much. I want to follow up again on the vaccines. It was asked of the vaccine that is coming, which manufacturer is it coming from? Do you have that information at this point? Or, again, we're hoping that it's going to show up on the 15th of November.
JP, we do not know the manufacturer of the first vaccine that we'll see allocation from, but again, as soon as we have any more information, we'll be sure to share that.
Yeah, and
Thank you.
This is Dr. Clayton. The one thing I would say, on that, that part of that process is, as people kind of have alluded to, is the manufacturer needing to submit their entire application and all of the materials to FDA for their consideration and review, and that FDA will go through their review processes. And so, while the state does stand ready, to administer that vaccine, There's no specific information that has been provided to the state around what vaccine may first become available, and where all of the manufacturers are in terms of preparing their applications for submission to FDA and review by FDA once they have been received. So we stand at the ready, and that's the important message for today.
If I can follow up on that, how long does the review process by the FDA take?
That's a good question, and one that I don't have a specific answer to. I know that they do have at least different levels of verification that they go through to make sure that they have an external independent review process. They have their other advisory groups. They have their internal staff review, and so it does take a period of time, and not having been part of those discussions in the past or in the preparation for the COVID-19 vaccination, I can't give you...
Tomorrow, Chef Lance shared some pictures of his new, or rendering of his new patio.
Jody, I need you to be on mute, please.
Thank you.
Then we go to Jonathan Ellis with the Argus Leader.
Thank you. Hey, we've gotten multiple sources who've told us that there is a private lab who has reported in the last week or two, maybe a little bit further back, as many as several hundred false positive test results. Has that been reported to you?
So I'll defer to Dr. Slayton for the process for reporting and re-reporting.
Yeah. So we do receive reports of laboratory test results. We have been notified of one lab in particular that they have identified through their internal processes some potential concern for the results that were reported. At the time, we have not received any sort of amended results. So the test results that we've received, we are acting upon, as we do with all other test results from all other providers across the state, and also those that are received from our commercial reference laboratories and so on. So if we did receive updated results, that would be reflected in our outreach to those patients that had those positive or negative results, and then what that amended result was. So yeah, and all of that is part of a process that we would work through with the submitting laboratory to make sure that individuals were aware of any potential concerns with their results.
Have they given you a number of...
That data would also on the website, and we would note, any kind of anomaly from that kind of a reason.
Do you guys have a number on how many test results could be in play here?
So there's been no identification of any concerns with the results that have been reported to us. There's been no amendment of results, and so
I think our understanding is that the potential results in question were under 300 total, and that those are being looked at.
Thank you.
Next.
Angela, can I...
This is Stephen Gross from the AP.
We'll go to Stephen Gross.
In the press conference yesterday from the State Medical Association, one of the things they said was that if the current trend continues in terms of cases and hospitalizations, that we will be facing a situation where hospitals are not able to give everyone the medical care that they need. I'm wondering, when you look at this current surge that we are having, and if you compare that with the surge in the spring, the surge in the spring, we saw the state was able to mitigate that, and I think one of the things was that people were able to go outside, spend time outside. The surge now in the current trajectory, I'm wondering if there's concern that as we enter winter and as we enter flu season, if the state will be able to turn the tide or to stop this surge or is the Department of Health anticipating a continued trend line of increased cases and increased hospitalizations?
Well, Stephen, this is Secretary Malcolm-Wrighton, and I'll just provide some comment based on your comments there. I think it's important to remember that what looks different today compared to the spring is overall hospital utilization. And so early on in the pandemic, hospitals across the state really held back on any non-emergent type care to make sure that we understood what was going to be happening with the COVID pandemic and potential use of hospital services for COVID patients. And so, back in March and April and even into May, we are seeing very little utilization of hospital-based services for non-emergent things. That looks different today, and so again, on the website, you'll see that we've got, over half of the beds that are used for people that don't have COVID. So I would anticipate, and the hospitals in the state are, doing an excellent job of really managing their resources and making changes within their operations to make sure that they're providing the highest level of care to patients that need it. And I don't anticipate in the immediate future a change in that standard of care.
Next question.
Can I follow up? Sorry. So just for my understanding, is there any indication by the Department of Health that the trend of increased cases, increased hospitalizations, and increased deaths will turn around at some point, or will the Department of Health implement increased measures to try to turn around the increase in cases that we've seen?
Yeah, so what I would say is we do look to the CDC and some of the modeling that they have done. They have now models out there both for nationwide as well as for hospitalizations and deaths. And so, I would say that is one of the areas that we have looked at to identify what we might expect for the next 4 weeks or so related to hospital bed capacity. And looking at some of those models, taken singly, that's not quite as effective, but taken across all of the different models that are out there from a lot of the different academic centers, you can start to get a sense of what as they come together in kind of what they consider an ensemble model, taking into account all of the different models out there, is that we will see increasing, based on that CDC projections, that we will be seeing increasing hospitalizations for the next several weeks, and then start to see a decline somewhere between the middle of November and the first part of December. But again, those are specific models that have been applied to not only the national level, but each individual state. And that was taking a look at South Dakota specific models for hospitalization projections.
All right, we have time for just...
the Rapid City Journal.
Go ahead, Morgan.
Can we get into the reinfection issue again? Does this mean these people have contracted it twice, the second time several months later, or is it just a resurfacing of their symptoms? And then also, curious what this means in terms of what we know about antibodies and any sort of immunity from COVID-19.
Yeah, and you do touch on a question that we don't have a lot of answers at this point. So the number of 28 individuals with what we consider possible reinfections. Those are individuals who have tested positive for the SARS coronavirus 2 a second time, at least 90 days after their initial. Those individuals are investigated by the South Dakota Department of Health, and in consultation with the person's medical provider to identify the index of suspicion for it to be a reinfection. We then classify those individuals as possible reinfections. Because there is no specific guidance at this point from CDC, we rely on that individual level consultation to make that assessment. and that is where we have arrived at 28 individuals with reinfection. What I would say is that what we have not seen, in the literature and so on, is what that means for protective antibody levels, and that's going to be, something that individuals who have previous infections that are followed for a series of time, and then potentially have reinfection. That's really going to be probably some of the most effective data to identify what's happening in terms of how long a person may still be susceptible, and when they begin being susceptible again after their initial infection. And so, that's going to be more on the scale of larger academic level research studies to help shed some light on that.
This is Angela Kennecke from Kello. I just have a follow-up on that question. When you said that you were sending these to the U of M lab, do these 28 people who came back with positive COVID tests more than once, 90 days apart, were their genetic sequencing of their tests sent to the U of M lab?
So that is not part of our currently existing protocol to assess possible reinfections. The ability to send those specimens to the University of Minnesota for sequencing is really more about the state having the capacity, if we have specimens to be able to send. What it comes down to is that we often don't have the initial specimen or the subsequent specimen because they are tested at an outside laboratory, and so that we don't have the opportunity to do that genetic sequencing on a routine basis. We do have, from the literature, that is probably the most effective way of identifying, reinfections and not having potential recrudescence of their initial, infection being a potential cause of their next positive test result or their subsequent test result. But again, that is not data that we have readily available to us because of a lack of access to those specific specimens.
And again, we are still waiting for the CDC guidance on how states should be determining confirmed reinfections of COVID-19, and that's important so that there's comparability across states.
All right, thank you all for joining us today.